So first, let me introduce myself. I'm Thomas Duparque. So yeah, as you can imagine with my accent, I'm French, and I am lucky living in Madrid in Spain. So I would have loved to travel to Mauritius. I know quite well La Réunion, but not Mauritius. And next time, I hope to have more time and more anticipation to visit you and to enjoy this beautiful island. So I'm the practice lead for healthcare in Zebra. I'm responsible for Europe, Middle East, and Africa. And my role as practice lead or business development manager is to spread the. There is different role, but one of my role is to share the best practice, to go countries to countries, analyzing the maturity, the needs, the project, and go and sharing what Zebra can do for healthcare. I'm a biomedical engineer. I study biomedicine, physics, and medical imaging, and I work for several years with Siemens Healthineers. So actually, I'm more able to discuss about process technology than printers and scanners. There is people in Zebra better than me. However, what is really interesting with Zebra, which is a printer, scanner, well-known company, is that they have more solution that you may heard, and we have a lot of partners. So of course, Cybernaptics is a great example of a type of partners which we used to call integrators, which we are working with, and we work with a lot of software, hardware integrators, small, big startup company. And this is interesting because for healthcare, it can bring a really clear solution, a really concrete solution for the project. And one of my favorite topic is how to improve patient safety, how to improve the clinical pathway. Of course, clinical pathway, there is a lot. Clinical pathway, you know better than me. There is a lot of things to work on in a hospital. So it was a not so short introduction. I'm sorry. I'm sorry, but I will move with the other one. So can you see the slide moving, right? Just to be sure.
Yes.
Yes.
Okay. So I'm not going to boring you on that, but just we have to start that all hospital, clinic, and healthcare government all around the world are facing some challenges, and the challenges are the same for everybody. It's mean that the frontline workers are more and more burnout. They are less, also less, and we exige them. We ask for the same volume of works every day. So of course we heard about the burnout of the nurse during COVID, but the burnout was already here and it's still here. Okay, and not only for nurse, but for all kind of workers, frontline workers. Communication breakdown, it's really important because we will discuss about that. To be able to discuss and to have efficient communication between workers, service, department, floors, it's something critical. We can say, okay, they have the phone, or you can ask, you can talk to this guy, to the nurse, to the doctors, but actually, it's not so easy. And previously to Zebra, I worked for a medical insurance company, and a lot of claims, a lot of error were due to lack of communication. Tolerance for error at all-time low, so preventable medical error. Yes, there is medical error in every hospital, every clinic, every institution, and this is not a bad thing. The bad thing is to say that we don't have any error, we are perfect. The good thing is to report properly the never event, to report properly the issues that we could face, and to try to improve that. Keep the data to feed and to improve this break into the process. growing and aging population. It's not nothing new. I will add also the raising of new disease like pediatric disease, pediatric um, cholesterol, for example, for adult. Um, but there is a lot of rising disease which need more care, which need more access to care. Profitability pressure and patient expectation. So of course, patient expectation is something that changed recently. That more, even if for the French and free healthcare, patient now want to have the best access to care, want the best service. You want to be able to choose the specialist, want to be to see a rating of the hospital, of the service. And to be honest, during when my first child born, the first thing that we've done with my wife is to see the rating of the service and hospital, even of the doctors, even if in the public you don't know who will attend you. But we were like this. So this is a more and more trendy. If I need to do EMR, I will also have a look on which EMR they have. It's a bad one, good one, new one, because I knew that, but more and more people are also see this kind of data. So uh, I'm not, of course, an expert in the Mauritian healthcare situation, but basically what I've read and what I've worked, because I also investigated about the market, the healthcare market in Mauritius, that is that you have a really interesting and good system. So you have you've made a lot of focus on coverage. You've made a good focus on the quality of health, which is not usually what I can see from other African countries, of course. And interesting thing also that you have some big disease. I imagine is like La Réunion, due to the how can I say that vaccines which are sometimes not done, or with some new disease like the chikungunya. I don't know if you call the chikungunya in Mauritius also. The dengue is the same. Okay. Chikungunya is the same also in Mauritius.
Yes. Yes.
Yes. Okay. So of course, with chikungunya, for example, or dengue, you also need more blood sample. You need also more therapy. You need more home care. So kind of disease like this need also to be treated and to be considered uh, for new market, new access. Let's talk about zebra. Let's talk about zebra. So I think that Divi already discussed about the company and the portfolio. So I will not again speak about zebra. I will really go on zebra for healthcare, and I will really focus on some application, because this is, I think, something interesting is to share you some application. So here we are missing the ambulance. I'm sorry, I don't know where is my ambulance here, but part of where we work are private, public, small facilities like mental health, elderly care center, ambulance, and all different kind of service in hospital. And we used to divide the hospital in different service. For us, it's easier to bring the right uh, not product, but right product and solution for the different group. And it's also different project. So for example, receiving and loading, we will see some case in pharmacy. We will see some interesting case for IT area, point of care, surgical theater, or operating room. It depends if it's in US or in UK, reception and laboratory. In Zebra, we will focus and we will discuss about that in clinical mobility as a solution. So this is our let's say the word we want to that you keep in mind. we will bring you a clinical mobility as a solution to improve communication, to also bring clear solution for the data capturing, to bring solution for the decision support, and to improve workflow efficiency. Okay, and we will also see that all of these solution for patient identification will help reduce medical error, support accurate decision for medication. All the clinical mobility part will, of course, ensure communication, sure, and to improve collaboration. We will talk about real-time access to critical care data, what we used to call interoperability. We will also show you some example in alarm fatigue, and also we will discuss about a really big topic that interests, of course, our partners, which is the real-time location and tracking. So as you see, and maybe you will go really quickly on that, we work with a lot of an ecosystem of partner, which could be small company only focus on software, big company focus on software, what we used to call independent software vendor. We work with the electronic medical records, what we call in French DPI, which are all the software for into the hospital for the administration, the work list, as Daedalus, Oracle Health, Cerner, Epic, Meditech, etc., etc. And it could also be some local in-house software we are working with. Of course, we focus a lot with them because they are the one who want to bring mobility. And who say mobility, I will also focus on that, say more efficiency in care. And we work also with some biggest partner like Philips, General Electric, some solution providers for alarm text, for example. So here it's just a sample, but we have a lot of partner who who we are building our solution. So let's see our highest maturity globally. I'm not talking about Mauritius, I'm talking about globally, where we are well known and where we work a lot, which is within the reception, within the laboratory, within the warehouse for receiving and loading, and storage, and within the point of care close to the patient. Okay, first case. So I told you that my ambulance was missing. The first case is that we are able to work with ambulance. Here is a case with Daedalus, which has a software for starting to register the patient from early stage. Could also bring the wristband into the ambulance in order to help for the triage in emergency, and also to be sure that what the box or the surgery will be ready with a with the information already registered, like the medication, like the age, condition, specific allergy, etc., etc. And here it's just missing one case for the ambulance because I'm talking about the integration of software for the workflow. But we can also work on track and trace, and we are working a lot of traceability into the ambulance, which means that every asset into the ambulance have a tag. Everything is track and trace, and it's allow the caregiver to be sure that all his equipment is on board on the truck before the intervention. So traceability of all the assets is a really huge topic for ambulance, really trendy topic. And also what I'm presenting you, which is the interoperability with some platform. Okay, so first we will discuss about admission. So admission, we are able to connect software to our platform. It could be a tablet, it could be a smartphone here, which allow someone in emergency or in the front desk of the hospital to scan a card, or to scan or to put the information of the patient and to give him a wristband. And wristband is the beginning of the journey. Okay, it's really important. I know that in some countries they used to say, Thomas, it's a long time we are putting a wristband to our patient. Yeah, okay, it's true, but what are you doing with the wristband? And the answer is nothing. This wristband is not used after, so it's just to complete the law, to complete the regulation, legislation, and okay, everyone is happy with that. But to be honest, the next step of this wristband is to use it, and use it mean be able to scan the information and link it to any prescription, for example, any care. And this is why for us it's really important to have a good wristband, because if you are not going to use this wristband after during the patient journey, okay, use the cheapest one, doesn't matter. But if this wristband will be used really to read the information of the patient, to scan any information like the QR code 1D, 2D, this is where you need a good quality. This is where you need something efficient, uh, which resist, which not gonna break, etc., etc. And of course, pediatric wristband is a huge topic, mother and child, which can be identified quickly, uh, and again, it's really honest because error in the maternity, with some exchange, with some error in surgery because the patient is not well identified, and it's Thomas Dumarque and not Thomas Duparque. And so we start the surgery of the knee, and the poor guy come here for the liver. Happen a lot, unfortunately. So this is why more and more solutions are put in place to identify the patient in efficiently. When we talk about efficiency, we can talk about efficiency of the transport for the patient transport. So here there are some examples with providers. One in France called Geosoft Aquitaine, which is the leader for the brancardage. So brancardage, it's the, how can I translate that? Is the bed transport? Yeah, bed transporter maybe. I don't know the exact word. I'm sorry about that. Where at the end, the caregiver in charge of transporting the patient will have the order, have the patient, scan the wristband, and after, when it put the patient at the right localization, it will sign it on the PDA, on the smartphone, and so you have a complete traceability for that. So it's a really interesting uh, software solution, and it's the same with the Oracle Health platform. Okay, of course, the same for the discharge. Uh, it's important to have the best solution, because sometimes patients stay a long time before having the to leave. So there is really some tablets which are used for payment station, for example, mobile payment station, if it's a private care like in US, or for uh, for other patient only having the authorization to leave. When we start to see some solution for point of care, this one may be the most attractive one. This is the one we are working mostly at the moment, to be honest, is the mobile nurse station. So mobile nurse station is really, really, really trendy, and of course, really efficient. Um, so basically, in the trolley on wheel, cart on wheel here, the nurse trolley, we are able to put some printers, so printers for medication, tube labeling, or some scanner, wireless with wire. We have a new one which is an amazing, because it's really small, and which also is used to connect a tablet or smartphone into a cradle. And this cradle is not only a cradle, is a station, what we call the work cradle station, which allow us to, or the nurse, to use all the application on the on the on the smartphone or tablet to be used on the screen. And so which mean that she don't need to go to their station to do the reporting. They can do it on the flight, and which also mean that they does not need any computer. So they only have this phone, and with this phone they can do everything. Of course, here you can connect keyboard, mouse. So what is interesting, in some countries, when you prescribe a drug, you give a drug to the patient, you need to scan the drug and scan the wristband patient. And usually, for example, in Netherlands, before after COVID, they had during COVID, basically, they had a case that all the nurse had to go into the room with the trolley on wheel, connect the trolley on wheel if there is no battery, or use the battery, whatever, and give do the care she need to do, blood draw or medication administration. But the thing is, when she and register it on the platform or on the computer, and go to the next door, next patient. But the thing is, when she go to the next to the corridor, she had to disinfect all the old trolley. So it take her like 20 or 30 minutes, 25 minutes to disinfect everything. They lose a lot of time. So it's in Netherlands, in Elizabeth Twisten, this case. We have something published. And so they decide to put this solution with a smartphone. And of course, with the smartphone, she just had to take the drug, take the smartphone, go into the room, give the drug, or do the draw for the blood extraction. And she just had to disinfect the device. So of course, you disinfecting a device, it's 1 minute. So this is why it started to have some part of interesting, efficient stories here. Okay, this of course solution are worked with and integrated with all the EMR, EHR, electronic medical record, electronic health record, for the nurse mobility. So here with Epic, for example, and are also used for telemedicine. So when the nurse need to call the doctor or the specialist, she can directly do from the station, from her phone, and of course the specialist can attend the call and can also give some recommendation quickly. Okay, blood and lab sample. So of course, the interesting thing with this connected to the system device, as we saw, is that we can immediately send the draw to the labs, and the information of of the labs can be received directly in real time, or as soon as they get it on the smartphone. So this is where you can also move your patient to the next stage or discharge your patient quickly. Okay. All right. Next, about some interesting case, the connection with the laboratory information system software, what we used to call the LIS. So we saw that laboratory have some information, patient have some information from EMR, laboratory from the LIS. So with one device, we can connect this application, we can connect this this application, and it's really help for the transfusion progress, for example, or lab workflow, or tube workflow. So also we also work with some company like GPI or like Quid del Orto. We have a lot again, but they're just example for that. They're quite well known. Um, so again, some of our product scanner, which could be unfree, by the way. I don't know what she's handing the scan, but whatever. Could are used in laboratory a lot with these printers to retag the blood bag. Okay. Blood bag for transfusion, I don't know if it's from your concern, but can also be tagged with some. We're working with some RFID track and trace. Of course, the RFID chip is not stick directly to the bag. Okay, they are stick in another place, and we can also insert some temperature control, temperature indicator. Because I don't know if David introduced you that we also have a GAM portfolio for the temperature sensing, passive or electronic. Okay, reversible, irreversible. Um, so this is the kind of indicator you can stick on the blood bag and be sure that we did not break the cold chain for that. Okay. So again, this kind of technology we have, and free long range. They have a lot of accessory. The interesting thing also is the supply. We are supply manufacturer. We have actually two plants of supply, one in UK and one really new in Republic Czech Republic. So to allow us to deliver big volume and to attend the market for that. And our tag could be our tag is not a tag, it's a label, sorry, could be in different size, different quality, resist to high chemical to the high chemical, to the cryocool, etc., etc. We work also with some solution provider for track and trace of blood sample, and also we are able to track and trace this sample into a transport bag. We're able also to put an electronic sensor to control and monitoring and to do the monitoring of the temperature. And we also are able to put some clever scheduling workflow software. Okay. So it's for the pickup. For example, here it's a solution to allow transporter to do their road to pick up all the blood, but it could also be used for other topic. Okay, let's talk about supply chain, real-time health system. Also a really demanding part of what we do, we can do, and what is the market ask us to provide some solution is to be able to track equipment, chair, table, O2 tank, oxygen tank, for example, monitor, ventilators, etc., etc. Medical supply, specimen, as we see, it's not only blood tube, but it could be also for other specimen tracking, surgical set. So this is something we are working more and more everywhere. Is how to improve the streamline and the sterilization process. How to be sure that the set, what do we have into the set, which are the instrument. So we are able to link some RFID tag to um, any instrument, but we're also to use machine vision to be sure that this is the good orthopedic Dr. Thomas set and not the pediatric orthopedic Dr. X set. We are also able we are providing a lot of traceability with basic barcode and scanner for the surgical set to be able to localize them when we need them and to control the stock, medication, and IT equipment. So there is two ways to locate it patient. Let's do that simple. After you have all your specialists from cybernetics, which can discuss about that and answer you more technical question. But let's do it simple. There is two way. The passive RFID locationing. Okay, so basically we have antenna and we can detect if some asset go from zone A to zone B. And we have a new antenna which is also able to show the direction zone A to zone B or zone B to zone A. And we have the RTLS, the real-time location service, which basically use BLE tag, BLE, which means Bluetooth low energy tag. So it's a tag with a battery, and as he has his battery, he can emit a signal to the antenna. You also need antenna in both cases. Okay, so the difference is not about the antenna readers and bridge so much, but it's about the maybe the accuracy, and we can discuss about that, and the technology. In Zebra, we are pushing and we are more focused on the passive technology. Okay, we used to work before with Bluetooth low energy tag. Now we move only for the passive technology, which means that we are able to integrate any BLE tag from other brand. Okay, and we can provide you all the infrastructures, but we are not going to recommend to use BLE due to cost and due to efficiency also. We can discuss about that. Um, Intelligent management. So this is one case, one of the best case we have. Zebra globally is based in the NHS in UK in Hull with the Hull University Teaching Hospital. And the story of Hull is really interesting. If you give me 2 minutes, I will just try to summarize this story. So it's initially they plan to realize this RFID pilot as part of a campaign that they call Scan for Safety. Scan for Safety is NHS campaign, and they decide to focus the Scan for Safety in the intensive care unit (ICU), and so the patient of the ICU can be monitored, and also we can located the ventilators and the blood pressure monitors and electrocardiograph really quickly. So if the patient move and we need one of these device, the nurse will be able to see where the patient is, and also if they need any device, they could she will be able to locate the this device. And the COVID arrived, and with COVID, it was a great a great real time, the best real time situation because they needed the device quickly and all the time. So with this platform that they start to have, they really see the impact. They really see the interest to have the nurse or the care worker able to locate it, the device in less than 1 minute. Whereas they usually lose like 5 to 10 minutes to find a pump, if the pump is working properly, is the maintenance is really done. So after this small real test, they decided to put antenna in across all the services, and because it's already allow them to anticipate it. All is based in passive RFID, so they stick a label in everything. If the label get damaged, It doesn't matter. They stick another one. The cost is minimum, and they have a team of 2 or 3 persona, which is really behind the platform, seeing the indicators, what are we missing, and it's more after they connect 2 different hospital to be able to share some asset into the 2 different hospital. So now the trust label over 72,000 assets, and they also monitor 2.5 to 700 sterile trays each week. So it's a massive deployment for RFID RTLS in Europe. Okay. So when you discuss to the leader of this project, which is a really nice nurse called Rachel Ellis, and we have also some interesting white paper use case on the intranet, and you ask her why BLE, why not BLE, and why passive, she will say, "Oh no, BLE, forget about that, because you have to change the battery all the time. If the battery damage, there is a cost, and we never know when. It's expensive also. So BLE basically, because I know maybe there is some question about BLE and passive. From my perspective, BLE could be interesting for a small service, small amount of assets. But when you start to deploy and deploy and deploy more and more floor and more asset, it start to be a nightmare. So that's why passive is the best way. Is the best way. Okay, I hope I convince you. Next, raising use case: pharmacy, IT, and surgical theater. So I'm going to move quickly also because I'm start to run out of time. Um, of course, it's highly used for the e-prescription, pharmacy, and medication administration. I will show you that this platform, basically, this is with InterSystem, which is another EMR EHR, show that this platform allow patient caregivers, sorry, to 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 be sure that they respect the 5 right patient, right dose, right route, right time, right drug. uh, and for pharmacy, the other case, and I really like these videos, is that the fast inventory. One huge topic is how can I improve my inventory, the traceability. Up, let's see the video. So they tag, I don't know if you have the sound, but it doesn't matter. They tag all the asset all the time with their RFID. As you see, there is a small tag here. So of course it takes time to tag that, but after, for inventory of the nurse trolley, it's done in only few seconds with an accuracy of 9.9%. So here is the example with drug, but of course you can see some goods. So this is the same with use case in retail. This is the same use case in manufacturing, and this is something that we work more and more in a hospital, because hospital want also to be more efficient on that. Okay, so yeah, again, we have a lot of partners we are working with. We can also add some electronic tags to show and to count the drugs and device in real time. I think that it will be part of one discussion, or it's already a part of the discussion with Cybernaptic, because as integrators, and I don't know who is here. Is it Kelly here, or who tried to shoot us? But uh, the as an integrator, your Cybernetic is really able to work on that: asset checking, checkout, asset tagging, all the mapping, the track depreciation and warranty, track scheduled maintenance. It's really important to predict also and to anticipate unexpected reparation and create run and share report. Okay, here I'm going to skip quickly just to say that we are a GS1 global partner. We are working really well with them. It's really important to be a GS1 global partner because GS1 is the reference used globally in the hospital, and into the hospital we see a lot of different use case, different codes, different information need. mm? And with all the UDI, unique device identifier, UDI regulation, UDI regulations in 2023. There is before, but 2023 it's for um, part of the class 2, if I'm not right, not wrong, um, obligation. All the institutions have to be compliant with that, which means that they need to show all the codes, the product, the lot, manufacturer date, use date, serial number. But in some case, we also need information like expiry date, manufacturing, and all this information. Not all the scanner are able to capture it in only one shot, one click. So I'm not talking about RFID technology here. I'm talking about scanning technology, because a scanner could be seen as a stupid scanner, but to be honest, there is a kind of program behind this our scanner, which make them efficient, which make them compliant, and which help a lot. Okay, 1D, 2D codes. Some institutions are interested in coding and tagging in 2D codes all their assets. So this is a kind of interesting use case to be sure that it will take a small place, and to be sure that all information will be on the load or on the asset. And so for that, again, we have this new, as you see here, this is not the new one, we have a new one, and small on-free scanner, which is massively used, for example, in France, in the pharmacy, into the hospital, but also in the city pharmacies. We have the classic one, which is one of our bestseller. And recently, uh, you may have heard about the fixed industrial scanner, what we call FIS, fixed industrial scanner. There are new acquisitions since 1 year. Basically, it's a small head, small scanner come to our portfolio that are massively used in manufacturing, to detect some error, some colors in a really high speed chain conveyor, which we also use into the hospital. So we have this solution. Just let you know that this is not only a scanner, it's also machine vision, and we're also able to bring some software. And I did not show this example here, but for example, in France, we're using that in CHU to precisely read the tray and make a snapshot of all the instruments and be sure that no instrument were missing for the procedure. So it's a really intelligent software um, with some warning and alert and alarm that we can set up to be sure that the surgical tray will be the right one with the right instrument. Again, so I will skip this video. Lack of time, it's a long video, but you will see that for the laundry, I'm trying to just to skip to okay. You will see for the laundry, they tag all the laundry, and they are able to control their stock. For the clothes, they insert some tunnel for the dirty laundry, And it's a really interesting use case. You see that when they prepare the clothes, they put a tag, and so when they pack the for the procedure, they know exactly what there is, and they can control the loss. They can control the stock also into the different floor. Okay, so I made this quick, but I put the link so you will be able to see that. And we have a specific tag for the textile also, RFID tag for textile. Patient vital sign information. It's a really interesting use case. Again, I'm trying to go faster a little bit, where we are able to connect some all the information to our device, and we're also able to bring uh, software from a company like Maximo, Philips, Tiger, Mindray, which not only give you the visibility of the patient monitoring device, but also can send alert. And from this device, you're also able to communicate. Hey, what's happening? Are you okay? Is it right, or are you in a bad situation? Um, and of course, all this alert management system uh, was done because there is a real need, and there is some situation where the patient was in a critical situation and no alert were sent to the worker, which can be a problem. About OR optimization, we are working with some OR scheduling. So also interesting for the workers to say, okay, you are in preparation and you are ready. I will inform the service. So again, patient is ready, is prepared. The doctor can have the view on that. They can let the patient enter. You know that the room is ready also. It's clean, has been disinfected, and it is not losing time. It's not losing time. And we all know that for operation, we need to optimize time for cleaning. We need to optimize time for the patient workflow. So all these platforms are really used a lot, and in a mobile way, better. And again, for OR, track and trace, one of the big use case here, for example, in the angiography or surgery, we use a lot of material like catheter, balloons, wire, instrument, and it's really important to link in real time the device or what you are using to the procedure and to the patient for any cost reimbursement or for any traceability of the device you are implanted to your patient. Again, for chemotherapy, for example, here an example with Bibron, they have this OncoSafety remote control software. Is really interesting because they can apply the 5 right. So right patient again, scan the drugs, scan the patient to be sure that this is the right chemio drugs. But they also have the information of the pump into their smartphone. So if the pump gets stuck or stopped for any reason, they can just check if it's a false alert, is a real alert, uh, and more. They're also sure that the right and when it's ended, sorry, when they finish the treatment, they also receive an alert, so the patient who received the chemio can quickly go home. So with this device, that's why we really push on clinical mobility. This is again one of the biggest future. Uh, we have the patient record access, nurse call and alert, all the communication and desk phone, the alarm management, remote monitoring, patient identification, the workstation desktop, secure messaging, telemedicine, wound management, and there is more and more application. As we discussed, the workstation is something we are pushing a lot. There is a new trend with which is the nursing home or home health. So we are working a lot with nurse with tablets and smart device because they use the professional device to go at home and to realize uh, their what they have to do. And home health, we have a more and more case for telehealth for specific patient like chronic disease, for example. We have device for every workers. It could be healthcare device, or it could be or professional device. Okay. The advantage of the professional device, basically, I will not specify again, but this is a specific plastic which resist to more agent for disinfection, and they also have some button alert alarm. So it's quite interesting. You can see here the red button. It's behind these devices. Uh, of course, where we are different is with the consumer device and other brand that we have a lot of accessory to charge, to carry. But this is just a sample of some accessory we have for example, is to charge different battery. So you don't have to charge your phone. You can have some battery, and you can when you move the shift, the nurse to the frontline worker, and the battery is empty, you can remove the battery, put the battery to charge, and put a new one and start their turn. So more efficiency. And it's almost my last slide to recap all the benefits of why a professional device and not a consumer smartphone. Higher IT cost at the end, higher infection risk, more connectivity issues, more model to jungle, battery which are not removable, missing certification, more device failure, of course, more hard cost, lower quality of care, and the device cannot be shared. Okay, uh, and you already see the why zebra, so I will not repeat that, but maybe just to say that a lot of cases that we have in retail or manufacturing are sometimes used, or solution are sometimes used for healthcare. And so this is interesting. Again, I will repeat that we have a huge ecosystem of partners, and we spend a lot of R&D. We every years we have new device, and it's the same for healthcare. We have new healthcare device all the time, every year. So on that, I will stop sharing to see you if it's okay. If I need to share again, happy to do it. And I finish my presentation here.
Thank you, Jamal. Merci.
Merci. Is there any question, or is there any something you need to you did not understand, or I mean, I'm free to answer.
Yes, thank you very much, Jamal. I think we'll open the floor to questions. Yes, we have a first one. Maybe if you can state your name and your organization. My name is Duparque from the World Health Organization. And there's a lot of information, a lot of data capture. The analytics, what kind of reporting comes out of this for decision making? With all the various pieces of information we are tracking, we are tracing all kinds of things. What capacity does all this have to analyze it, generate the right pieces of information, trend analysis, whatever we need to do to use the data? It's not just tracking the processes, but it's the information we get out of it to inform current and future decision making. Over.
Yeah, I think so. The question is about you are able to capture a lot of data. What are you doing with the data, right? And how do you manage that data? Basically, we don't forget that we are solution provider. We are highly focused on device. So our device are able to capture the data. After the data have to be processed by a software, so software providers. So this is where this does not belong to us. First, we need to understand which data are you interested in, and what is the purpose of the goal of that? Is it for KPI analysis for patient? Is it for drugs? Is it for stock? But basically, the trends, we work with the biggest cloud provider, the Azure, the Google, and we work with other, where we are able to stock the data on this famous data lake, or our providers are able to stock this data on the data lake. But it does not belong to us to say what we are going to do with the data. It belongs to you, and it belongs to the software provider to after build the road of where the data will go, under which RGPD or frame line, because there is all the RGPD behind a lot of data. So yeah, we are more focused on capturing the data. What's happening with the data belong to the software provider after, and to the end user.
Just maybe add to that as well. So organizations like, for example, like Cybernaptics will be able to provide you with the insights that you require. So building the dashboard, what you want to see, whether you want to see asset utilization, whether you want to see the actual patient journey, whether the patient has been administered the right sort of medication and so on. So that data that we are capturing is then passed on to software organizations that will manipulate the data and give you the outcomes that you're requesting.
And just an example I will give you about the data sharing. We work in Europe in cross-border data sharing to try to get access to care with the data from other countries. So we are working, for example, with Daedalus. Daedalus have their command center, and the command center is a big cockpit where they are able to get the data from the patient everywhere it is. But Daedalus will not capture the data and will not make the data flow. So we also make a use case with the Greek company, which have the Health Pass. Health Pass, it's an application with a 2D barcode. And in this 2D barcode, there is all the patient information and history. And this barcode is able to travel in different countries and to be captured by a lot of systems like Daedalus. So when you travel Greece to Italy, for example, and you scan this your barcode on your iPhone or Samsung, all this data will automatically be captured by the data center. But after, where is the data? In a lake, or in your device, or in a cloud? We don't know. It depends. It depends on any case.
Thank you, Thomas. We'll take another question.
Good morning, everyone. I am Dr. Shohraj. I'm an anatomical pathologist. Thank you for this very concise presentation. I have two questions. First is about security. So you're working with the NHS, which deals with high volumes of data. Have you been exposed to a system breakdown? Please tell me a bit about the backup and what happens in case of a breakdown. Second question, for the motion context. So currently the system is completely manual, we just dealing paperwork at the moment. In your opinion, how long do you think it's going to take to make the system become digital approximately? And where is the best place to start, or where's the best department to start? Thank you.
Okay. So I'm really glad that you asked this the security topic. So you asked you ask about the security of the data in case of breakdown, for example. So it's interesting because communication it's critical. So device have to be connected to your patient. So of course, an ECG or ventilators in your hospital, you have a plant, and in case of electricity breakdown, that you have the plant which will give electricity to supply that. But for communication, if the Wi-Fi fall, it could be a quick chaos. That's why in some countries like the Nordic, all the device used for this interoperability topic, monitoring, communication on the smartphone, tablet, it's mandatory to be Wi-Fi and 5G or 4G. And we have a specific gamma of product, which is healthcare, Wi-Fi, and also allow 5G if there is any breakdown or any issues. So in this case, you will continue to have access to your portal, to continue to give care, give medication, to continue to communicate. And once the Wi-Fi will be again okay, all the information will go to the server or to the cloud. It depends. But this is why having this kind of device, a professional device, is really important to continue to have the care continuity. And you did not ask about the cybersecurity, but just to give you two topics about the cybersecurity topic. Uh, with this device, it's really easy also to configure a platform to identify the worker, or to identify the worker at the beginning of the nurse, to lock down quickly the device with face, but also with the card. Okay, so you're able to tap on to single sign on, single sign off, SSO. So we have this capability to control, but we are also able to control where the device is. It's really interesting because in case of lost or someone stealing this device, you can deactivate the device, make it totally unuseful, and you can also localize it into the hospital also. Okay, so in terms of cybersecurity, we are working with some companies. I imagine cybernetics also can work around this topic, in how to protect and to ensure that the information you will capture on the device will be will be treated as a safe way. And about the next question, it was I forget a little bit. It was about the adoption.
How long it will take to implement a full system?
So depend. Yeah.
I'll ask again. So currently in the public system, everything is manual, it's paperwork, and we have loads of data to deal with. So we are planning to bring in LIMS. Since a long time we've been working on it. How long, how many years, how many months do you think it's going to take to make the system become digitalized? And where's the best place to start? Where's the best department to start?
Yeah. So I mean, it's maybe a complicated question, because it depends on the size, on the infrastructure, on the people and the skills that you have to do that. But basically, what I've saw from hospital which are not digitalized, they usually start with the patient administration. So from the admission, where you can first digitalize the work list and where the patient have to move to the different doctors, consultants, consultory, or OR. So I think the easiest one is for the admission, and for the point of care. So the patient on the OR. When you start surgery is always a more complex words, because you need time to digitalize, you need time to train, and basically people in surgery don't have time to do anything. So yeah, I mean, for me, the easiest way is to digitalize the hospital, all the hospital. But if we want to do step by step, I think that admission, bedside and surgery is like the correct way to do that. Of course, we're not talking about digitalization of the warehouse, but warehouse to digitalize all the receiving, the stock management for pharmacy or for the different services could be done anytime and kind of in a parallel moment or independently.
Yeah, perhaps if I may add a comment just to bring it to the Mauritian context. Your question was how long it's going to take. Yes, I think it's like asking how long is a piece of string, you know? But to give you my personal opinion, in our context in Mauritius, the problem is the procurement. I think if you look at how the public sector procure solutions, you take the health sector, because actually I've experienced it. The way if let's say they want to digitize, everybody wants to digitize, from the public servant to the minister. But what they will do is they will get maybe a consultant coming to write the specs. And the consultants tend to be paid by how much output they produce. So they will produce a set of specs that will bring in all imaginable features that you could think. And in the end, it's like a tender that big. And first of all, it becomes a very complex project. It's going to be very expensive. And also, it takes a lot of time to implement something which is complex. I fully agree with what Thomas was saying. What we need is a phased approach. Because at the moment, let's say patient registration, you go to public hospital, you're still using the card system. It's the manual system. So we could do that first. And then maybe the second instance, maybe we can do like the labs, you know, for blood samples, analysis. So you could proceed in phases like that. I think that is the message, perhaps, that we have to convey to the decision makers. Because going for big bang approach, not just in health, but in all aspects of the public sector, I found that they go for very complex tenders. And also by going through the complex tenders, you eliminate most local service providers, because, you know, we live in Mauritius, we don't have so much opportunity to handle such large and complex products. So then it will be maybe someone from India, someone from Europe, they come and implement. But at the end of the day, you have to ask yourself, who will support it?
And again, I think they know the cost of what they pay. I mean, all the C-level in the hospital, or at least the CFO and the financial officer, know what is the cost of the insurance bonus at the end of the year. And the insurer base their bonus on all the error, all the crash they pay. And basically the patient misidentification, where you changed your patient, you do the bad treatment, bad drugs, this kind of error, they know that it costs them money. So when you are able to digitalize the process, the work list, to identify your patient, at least you give some piece of solution to try to lower the error for that, which means for the C-level, an intention to get a lower bonus at the end from the insurance.
Yes.
Hello, good morning. I am Bhavna from Nouvelle Clinique du Bon Pasteur. And during your presentation, we came across an interesting video whereby you showcased the scanning of drugs items for stock count, I presume. And I'm sure during your implementation, you have come across drugs where it is being managed in units or in milliliters or etc. I'm not going into the detail. And I would like to know, how did you address the counting of these stocks, the stock of these drugs, which have already been dispensed in units, in tablets, or in liters or milliliters.
Yeah, so of course, I was showing the inventory and the drug administration on package, but you mean how do we do and which solution can we put in place for the unit dose, right? This is the so first. There is a big company or big robot or machine that you already saw that are done for that, but they cost a million. I don't know if million, but they cost a lot. But what we saw and work in some countries like Portugal is on the trolley on wheel, where the nurse have their preparation. They put the aspirin and all the drug they need on the small cup. They're able this cup to print quickly the drugs and to put the tag on the glass, on the plastic glass. So they are able to prepare their unit dose and tag it to give it in another moment. So this is something that we have done with the printers and with the system on the phone to be able to tag it. Does it answer to your question? More or less.
More or less, so you mean we have to already count these separately, put it in small bags, tag it, and then like have a stock count of this?
Yeah. Now we have more solutions. We have more solution for that. We have a smart trolley. The smart trolley, you will not have to do it manually. You can directly on the tablet ask for the dose or respond your prescription, and the system will bring you automatically the cup with the unidose for the patient. So we work, for example, here with two providers in Italy. Antares Vision, for example, is a good one, or IPSA, and their work is really to bring this solution alive with this trolley, smart trolley. It's really light. It's not a huge armoire to do that. Okay, and maybe the last thing we're working, it's more a concept, is with this industrial fixed scanner. So you see this intelligent artificial, it's kind of artificial intelligence. It's a machine vision that we have the same on the trolley, and this trolley is able to detect the drug and to detect which drug is it. So it's mean that when you put the drug on your basket, right, the camera will automatically detect that this is aspirin 500 gram or acetamine or whatever. So it's all based on the data intelligence and machine vision.
Thank you, Thomas. Yeah. Perhaps just to WHO, your question earlier was on data. Since the WHO is in a position to advise governments, and including our government, I think I would like to have your opinion on the having a national health database. Especially, here in Mauritius, we have both public and private care, and it can happen that someone starts having, let's say, care in the public sector. Maybe he or she is not happy and then transfer to private or vice versa. But there is no possibility of sharing data. I would like to have your opinion on that.
Thank you for that. Currently, there are discussions, very early yet, as to that they need to have data accessible to everybody in the health sector space. Public, private, for the patient, totally couldn't care less where they went. We need to know where they are, what is happening, where they are interacting. So that discussion has started. It has issues of regulation, it has issues of access, differential access and things like that. That's there, but that's just part of what the issue is about. So a common database is important. Access to that is important. There's work currently we're trying to develop the architecture for such common databases and to decide who can access what at one point in time. Yes, there are issues of even the use of the information. As I said earlier, a lot of the people shop for health. Even within the public sector itself, from one perspective to another, I don't like it, all that needs to be cleaned up. So that will be cleaned up. So there's commitment to it that this is necessary. It's a dialogue process. WHO does have a network and the capacity to facilitate doing some of these things. So it's a process that has started, and we just can hope that will continue. It's important that there's a new strategy development process ongoing because the current national strategy ends in 2024. So there's a review process that is about to start, and hopefully in June, July, a new one will be there. So some of these issues, I mean, that's why I'm here also, just to hear what the team and what's going on. If the seed is planted there as a national priority, it gets traction, and then we go. Thank you.
Thanks very much. So I think with that, I would like to conclude. First of all, I'd like to thank Debashan and Thomas for their participation. I'd like to thank you for participating and turning up. I'd like to thank Kelly and her marketing team for the fantastic job, of course, as usual. And we have lunch, the most interesting part of the program. And we can talk more and share lunch together. So with that, I think I'll end here and invite you all to proceed to where will lunch be served? In the main restaurant. Thank you.
Thank you. Bye-bye.
Merci.
Merci Thomas.